Hi guys, my name is Stephanie Stout. The age that I was assigned was middle childhood, which is 6 to 12 years old. The topic I chose is mental illness in children. I will focus a lot on trauma and mentally illness. Right now, I currently work in a residential treatment facility that is a trauma based facility. We only have kids that are mentally ill due to severe trauma in their lives, and they're very interconnected, the two. I feel like a lot of mental illness is a result of a lot of different kinds of trauma. I also think that because our program is focused towards trauma, that it's actually a really good thing to look at how they work together. So, the first part is going to be Erikson's theory of psychosocial development, which is 8 stages of development that deal with social interactions and development at different points in the life. These phases extend throughout your entire lifetime. And so, specifically, mine is middle childhood, which is stage 4, which is industry versus inferiority. Um, Children need to be productive and have successful experiences. Children are busy learning, playing, which is giving them opportunities to master various tasks. Children who are able to find ways to succeed will learn to be industrious. Those who experience repeated failure will develop feelings of inferiority, hampering their chances of success in the future. That is how our book defines this stage. So, to me, that pretty much means that at this stage, it's very important that children are being brought up in the right kind of environment, that they're learning and that they're playing, and that they're learning from people who are encouraging their development rather than hindering. That in their social settings, they're able to explore and try things on their own for the first time. A lot of times, children that are a little bit mentally ill, this is going to cause a severe problem because they might not be as developed as they're supposed to be at this age. They also might have a lot of trouble going through this stage because they're going to find themselves possibly failing at some of the tasks that they're attempting because of a mental illness that is hindering them. So I find that a very key phase at this point because these children need to start growing and learning that it's okay to try new things and it's okay to fail sometimes, but they also want to see the success. And if they're not seeing success based on something that they don't have a control of, it's going to cause a really negative self image and it's going to hinder them to be able to keep progressing to the next phase. There's a great picture that shows you the different stages, and actually, the man is perfect. He's on the stage I'm looking at, which is industry versus inferiority. So, we want our children to grow and be industrious in the world. Um, so I'm going to focus on what is trauma for beginner, like for the beginning. I saw this definition, thought it was great. The word trauma is used to describe experiences or situations that are emotionally painful and distressing, and that overwhelm people's ability to cope, leaving them powerless. Trauma has sometimes been defined in reference to circumstances that are outside the realm of normal human experience. Unfortunately, this definition doesn't always hold true. For groups of people, trauma can occur frequently and become part of human experience. So that's talking about our children who are constantly undergoing physical abuse, sexual abuse, and things that are occurring every day in their life. And a lot of times at such a young age, the children aren't recognizing that it is trauma or recognizing the wrongness and the problem with it because they're so young and because a lot of time it's coming from caregivers and people that they trust and people that they expect to take care of them and do the right thing. So, for the children that undergo the trauma on a daily experience, it becomes natural for them and part of their lifestyle, which can lead to really severe long term effects. The types of trauma that children undergo are sexual abuse, which I already talked about a little bit, physical abuse, which can be a lot of different things. Physical abuse encompasses a lot of different types of any kind of hitting or anything that parents are constantly laying their hands on their children for negative reasons. Neglect, which also encompasses a lot of things. Neglect for children means not taking proper care of them, not giving them proper hygiene. Children will, that's a huge thing. We have a lot of children in my facility that don't know how to do proper hygiene. It's an event that like in a school would be a very embarrassing situation, or just neglecting your child by not being there. Children are left alone too many times and at young ages, and they're not being taken properly care of. Substance abuse, if a parent is constantly drinking or taking prescription medicine or anything that's not a prescription medicine, any kind of drug, and the children are constantly exposed to this, they can either, they can have a substance abuse from just being around it so much, or if a child is born addicted to a substance, that's another type of substance abuse, and that's also neglect. It's also, it encompasses a lot of things. Just being around a substance a lot at a young age is a very traumatic thing for a lot of children. Starvation, which is sometimes not even the fault of a parent. If you're in a poor socioeconomic situation, your child may undergo severe starvation. Starvation is something that affects children very negatively, especially in a school setting. They could be sitting in school and it could seem like they're not paying attention or they're acting out or something of that sort, but they could really just be hungry. And we see that a lot of times at my facility as well, that our children, they'll hoard food even though we provide them 3 meals a day as well as snacks. They're so used to that, not having food and constantly not knowing where their next meal is coming from, that they become obsessed with the idea of food. They're constantly, when is it lunch? What are we having? It's a constant thing that comes from being so traumatized, from never being able to know when they were eating or knowing what they were having, or just the bare minimum of food they were provided. And a lot of times this comes from just their money situation and their economic situation, which is really sad because they're not even their parents trying to hurt them. It's the fact that they really can't provide. So it's a huge thing I see a lot. Natural disasters are types of traumas, absolutely, that, you undergo a severe fire or a hurricane or an earthquake, and, you have this horrible fear of these things because it ruined and damaged so much of your lifetime or your lifestyle, or it, wrecked your home and now you don't have a home anymore, and it becomes an ongoing cycle. You'll become afraid every time you hear there's a hurricane, and it starts to like create a panic and a fear and anxiety about this type of natural disaster occurring again, especially if you live in an area where you have wildfires or you have earthquakes or a lot of hurricanes and things like that. It really becomes something that you're constantly thinking about in the back of your head. Another one is chronic illness. To me, this was a very interesting thing to hear about. I personally never really thought of a chronic illness as a type of trauma. However, the more I read about it, I realized that it is really prevalent in trauma. And I also have a personal example to share about trauma in chronic illness. So, what it is that a child who has, say, cancer or a type of like diabetes or something that is constantly happening to them every day, and it causes a sort of depression in them, or an ability to not want to continue because they're so chronically ill, and they turn to not doing the proper self-care and not trying to be part of their health regimen or treatment because they feel a sense of hopelessness over this chronic illness that they're constantly facing every day. A lot of children who are in the hospital, in like a cancer ward of the hospital, you'll tend to find their spirits low a lot of the time. That's why they try to bring in people to uplift them and try to have a lot of positive people around them all the time, because otherwise these kids don't really have much of a quality of life at this point, and they're going through testing and procedures, and it's really starting to have an effect on them as a person, which is absolutely understandable at that point. So, my experience of the chronic illness in my facility is that we have a boy that a lot of us are wondering what his trauma was, because he's very well behaved and he doesn't seem to have that many of issues like a lot of our children. But when we looked in his file, we discovered some things about having issues with caring for his diabetes, and that is his trauma, is that he has had this diabetes his entire life as a young child, and it's hard to keep up with, and it's exhausting, and he sees his friends eating whenever they want, eating whatever they want, going out at recess, as he's constantly having to go to the nurse's station to check in and let them know. And this kind of thing has really over time worn on him to the point where he kind of gave up on his treatment, which couldn't, like, in turn end up killing him if he isn't taking good care of himself. So he's now with us, and he's, I guess, 9 or 10 years old, and this is his life now because he needs to focus on his treatment and getting better, and he needs to focus on his health and why that's important. And for a young kid, that's kind of hard to understand that, you have to do this insulin and all this type of stuff every day because of your disease, which is hard, absolutely. And I completely understand that it's a difficult thing to understand at such a young age. So, the effects of trauma on children. So, there was an article I read that was all about fight or flight, and that our children who have undercome or undergone severe trauma all the time will start to learn the fight or flight response, that they'll either try to attack, which is a lot of where aggression comes from the result of trauma, and aggression and mental illness and mentally ill children. A lot of them have the aggression because they've learned that either they stand up for themselves or they dismiss themselves from the situation, which we see a lot of like attempts for that. We see a lot of attempts for elopement. I mean, I've read a lot of things about children wanting to elope or escape their situation. It's a form of withdrawal. So the next thing is disassociation, which is also part of a mental disorder called disassociation or dissociative identity disorder, where the children will actually undergo something so traumatic that they will split and they will have different versions of themselves, so their mind doesn't have to process everything at once. They attempt to process it at different times so it's not as traumatic. They lock it away in a different part of their brain that only comes out when it wants to, and the two don't mix. So currently, like, it's very tough with this situation, especially in children, because they don't understand what's happening, and it's hard to evoke these different disassociations to treat. Um, Attachments is the huge effect from trauma. A lot of children who have very negative backgrounds and negative issues with their families have a hard time forming attachments. Um, they can also lead to, the trauma will lead to long-term mental illness, especially if it goes on for a long period of time as a child. You might have a mental illness when you're an adult, and it might go on for your entire life because you can't exactly be cured. You can go through recovery, but something like this, your mind has crazy effects on you, and trauma has a crazy way of working with your mind. And you could probably go on to have mental illness for the rest of your life. Another effect of trauma, which I mentioned with disaster and things like that, is your anxiety and your constant fear. You'll have an anxiety and constant fear of if you were starved, like I mentioned, or if you were sexually abused. You might have a lot of anxiety when it comes to any kind of intimacy or any kind of working with the type of person who abused you. I mean, we see a lot of our children are females who have been victims of rape or incest and things like that, not being able to work with our male staff. And that's because their trauma is so prevalent that they are unable to work past that and see that these people are trying to help them because they're so afraid, which is completely understandable. And that's the kind of thing, you need to work with, because a lot of these children, they have not developed enough to completely understand what they're going through. They'll also have a mistrust, like I mentioned. A lot of females who are molested or raped will have a problem working with males. They won't trust them. A lot of we have boys who have a lot of issues with their mothers who prefer working with our male staff. So it goes both ways. And it's because of this severe thing that they've gone through in their lifetime that has really changed and differed their perception of the world. So what is mental illness? Now that I've talked about trauma, mental illness is a condition that impacts a person's thinking, feeling, or mood, and may affect his or her ability to relate to others and function on a daily basis. Each person will have different experiences, even people with the same diagnosis. So that's something that's super important to remember, that even though you're working with two bipolar children, it doesn't mean your bipolar children will behave the same way. Most of the time, they've come from different backgrounds that have caused them to be bipolar. I mean, maybe similar situations, but each person is completely different. So you have to take each diagnosis and each individual as an individual, as for what they are. So when working with them as a social worker, as a therapist, whatever you go into, you have to remember that no one person is the same. And you have to take that into consideration, and you have to be careful with this kind of stuff because you don't want to offend them or you don't want to make anything worse. You want to make sure that they feel safe in their environment, and grouping them a lot of times will make them offended because you're bipolar, you're this, you're that. But that's not always the case. Sometimes, two bipolar kids will act completely different. And you have to always remember that when working with your children, or anybody for that matter. Mental illness can affect people of all ages, which I'll get into later, but there's a lot of controversy with mental illness and age.